Namaste, my name is Amish Tripathi and I'm the director of the Nehru Centre, London. Now, some may think of Nehru Centre as just this beautiful fine building, and it is a fine building, no doubt. We have a wonderful art gallery out here. We have an awesome auditorium on the first floor with a capacity of 100 to 120 people right here in the heart of central London in Mayfair. But the Nehru Centre is a lot more than this fine building. The Nehru Centre is also an online platform. We are available on Twitter, on Facebook, on Instagram, and on YouTube. And so the Nehru Centre is actually wherever you want it to be. Of course, we'd love for you to come to the physical events that we organize out here when we do organize them. But do join all our online platforms as well. This is a hybrid world. We are going to have offline physical events and online events as well. So do join our online platforms and do keep giving us feedback of what you think of it. We'd love to host you out there. We'd love to hear what you think of our events, and do keep sending in your suggestions as well. We do keep imbibing and learning from the feedback that you give to us to give you programs that you guys might enjoy. Thank you so much for your kind attention. Namaste. Jai Hind.
Namaste to all. I am Dr. Prakash Hegde, working as Professor and Dean Academics for PG at SDM College of Ayurveda and Hospital, Hassan, Karnataka, India. So I'm in the clinics for last 20 years, and I do have some experience in treating some of the allergic cases. And even though my main area of focus is diabetes mellitus, but I do get so many patients who are having allergies and all those things. So today I'm here with very important topic, that is Ayurvedic management of allergies. So let us begin. What is allergy? So the definition goes like this: allergy is a reaction by a person's immune system to any external stimuli. So one which causes allergy, we call it as allergen. So basically it is a protein. So there are mainly two types of causative factors for allergy. They are either it may be genetic factors or it may be environmental factors. When it comes to prevalence of these type of allergies, so we can say like one or the other time in his lifetime, the person will definitely face this problem of allergy. We don't know actually which may cause allergy individually, but when we expose such allergies, then immediately we'll have allergic reactions. Then we may have so many symptoms, maybe related to skin or respiratory tract disorders, etc. So 25% prevalence it is noticed all over the world. What are the common allergies which we come across? So when we look at it, the very important one nowadays is food allergy. So because of unhealthy eating habits and the content of that preparation, which may cause so many allergy in any individual. Then another thing is contact dermatitis. Then a person may have a drug allergy also. Then there may be allergic asthma, like the person who exposed to dust and all, he may have such allergies. Then some people may have seasonal allergy also. Then some people again may have animal allergy, dandruff, all those things. So these are the common allergies which we come across. When we look at the types of allergies, so there are few allergies I can mention here. They are sinusitis, urticaria, rhinitis, asthma, drug-induced allergy, or it may be immune deficiency related allergies. All these are very common types of allergies. So what are the common causes of these allergies? When we look at the common causes, so these are the 10 important causes uh, which come into the picture. They are pollen, dust mites, mold, animal dander, insect stings, latex, food allergens, medication, cockroaches, and overreacting immune system. These are the 10 common causes of allergy. So when it comes to treatment part of it, in general, allergies are incurable in general, because we need to have such immune system, so that will not be having any such kind of reactions to allergy, so that once we are not reacting to it, then there may not be any symptoms related to allergy. But when it comes to treatment also, we have in Ayurveda, which has much to offer to prevent or to reduce the severity of the symptoms. There are varieties of treatments, procedures, and even medicinal plants which are available, but all these are depending on the severity of the symptoms. If there is only mild to moderate symptoms, which may be managed with common medicines, but one thing we need to have a precaution that, but if it is severe symptoms, then it needs to be taken special care, or the patient may have to be hospitalized. So all these things we have to keep in our mind. What are the common symptoms of allergy? So there are different kinds of allergies which are there, but the common symptoms when we look at it, so these are the common symptoms. Am I audible? Yeah, of course, there is some technical issue. Uh, Thing is here, when we are taking care of some allergic symptoms, really it is very important to control those symptoms. If it is so severe, then I think we need to be very careful with the management. But there are many medicinal plants, many procedures which are there for managing this type of allergies. Uh, but actually, all these things are depending upon the severity of the symptom. Um, Again, there is little technical issue. A second. Okay. Uh, Sorry, there was little inconvenience. Um, these are the common symptoms which we face when we face the allergies. What are those? They are the sneezing, where there will be runny or blocked nose. There will be itchy eyes, or it may be red and watery eyes. There will be wheezing and chest tightness, raised red rash that is itchy. Then there will be swollen lips or swollen tongue or eye or face, stomach pain, including vomiting or diarrhea, specifically when it comes to food allergy. Then these are the specific symptoms which we come across. They are the like if it is allergic rhinitis, the specific symptoms would be running nose, sneezing, nasal blockage. Then if it is dust allergy, then it is sneezing, coughing, and watery eyes. Then if it is skin allergy, then there would be rashes, hives, redness, or itchy bumps. Then if it is insect allergy, then there would be pain, rashes, and redness. Then if it is drug allergy, again there would be rashes, urticaria, and shortness of breath. Then if it is food allergy, then there will be stomach pain, vomiting, and rashes. So these are the specific symptoms we come across. So these symptoms, it helps us to identify the root cause of the allergy. So when it comes to Ayurveda, we always say about bala. That is nothing but immunity. So it's very well understood that if we are having a very good immunity with us, or bala, what we say, sahaja bala to be specific, then we call it as vyadik shamatva also. So then we can resist any type of disease, including allergic disease. Then one more very important thing here to note is naturally most of the people, they will be having a very good immunity to allergens, which are always present in the atmosphere, but few may have the deficiency of this immunity, so they are commonly prone for the allergic diseases. So what are the principles of treatment which we can adopt in managing allergies? The first and foremost one is avoid causative factors. So before avoiding, we should know what is the exact cause for this allergy. Then we can avoid such causative factors. Then we need to improve our immunity, or we need to have immunomodulatory medicines. Then we need to treat the symptoms of the disease. In Ayurveda, we have two very important conditions. We call it as Shita Pitta and Udarda. So there is aggravation of vata due to sudden exposure to heat and cold. So due to this exposure, there will be kapha and vata. They will be combining with previously aggravated pitta. Totally, they vitiate the blood or rakta. Then it is expressed on the twacha, that is skin. It is called as shita pitta and udarda. So, what is samprapti or manifestation? We can understand here. So, there will be Shita Vata Sparsha, means cold wind. If the person is exposed to cold wind, then there is aggravation of Kapha and Vata. So, if it is aggravated, previously Pitta aggravated condition is there. If that combines, means all three doshas are aggravated. In turn, it vitiates the blood or rakta and presents on the twacha or skin. So it leads to shita pitta. We call it as urticaria and udarda. So what are the common symptoms of this shita pitta? It is nothing but urticaria. Here, transient pruritic swellings of the skin, nettle rash can be seen. Then raised skin lesions in any of the area of the body. Then there will be severe itching. Then pink red or skin colored rashes which last for minimum 24 hours. Then the size, there are varying sizes, varies from that of a pinprick to several inches across. Then there may be association of allergic reactions, infections, or physical stimuli. So, what are the causative factors for this in general? They are allergens, exposure to sunlight, increased cold or reduced uh, temperature or increased temperature, then insect bite, chemicals, various medications, then any underlying health issues may cause this allergy. That is urticaria or Shita Pitta. So what is urticaria in general? So this urticaria is there, no, which results from antigen entering specific skin areas and causing localized anaphylactoid reactions. So histamine, which is released locally, which causes vasodilation, that induces immediate red flare and increased local permeability. So, what has to be done in case of this Shita Pitta or urticaria? We have several treatment modalities which is mentioned in our classical text and which is also commonly practiced. A very important reference which we have in Ayurveda is Agnimantha. This is one among Dashamula, which is botanically identified as Premna integrifolia. So the powder of it, it should be mixed with ghee. It has to be consumed for 7 days. That is one important treatment. Then a very simple treatment modality is mixing milk and haridra, that is curcuma longa, turmeric, what we call commonly say in our language. So these to be mixed, this is also called as golden milk, so which improves our immunity, and also this combination, the paste of this milk and turmeric can be applied over the place where the person is having lesions or severe itching. Then one more combination would be haridra, that is turmeric, curcuma longa. Then it is to be mixed with Cassia actora, one common plant. Then black sesame. So all these to be mixed. It can be taken internally also. It can be applied externally also. Then a very good combination which we have in Ayurveda is Triphala Churna. So very common, Amalaki, Haritaki and Vibhitaki. So this has to be taken in a quantity of 6 grams with water. So this Triphala Churna, no, it is very useful. It is very good rasayana. So rasayana, it always improves our immunity, or it helps us to have the power to resist any kind of allergy. Then one more thing is haridra khanda. That means we need to fry the turmeric powder in ghee. Then it should be taken with water. For the quantity is 6 grams. This is also very useful. So then one more condition in Ayurveda is udarda. So here the difference between Shita Pitta is, so there is patches of swelling, but here it is circular swelling with itching. So swelling is red in color, which is caused due to kapha vriddhi, that what aggravated kapha dosha, which leads to this condition udarda. So for this udarta also, we have a specific group of medicines which are told in our Charaka Samhita, Sutrasthana 4th chapter. These are the 10 drugs. They are Tinduka, Priyala, Badara, Khadira, Kadara, Saptaparana, Ashwakarana, Arjuna, Asana and Irimeda. So these are the 10 drugs which can be used either singly, or it can be made into a formulation. It can be used in the form of decoction, or it might be used in the form of powder also. So other side, this is the botanical identity of these 10 drugs. Then one more condition is difficulty in breathing. So that may be the outcome of any allergy. So in this case also we have several medicines which can be used commonly. One thing we need to be um, yeah, I think here I need to answer one question which is asked by Mr. Prashant Kumar. That is, what can we add in our daily food to boost our immune system? Very good question. Uh, we have several substances which can be added. One thing I can advise here, simple thing is adding required quantity of turmeric, that too 3 grams, with 1 glass of warm milk. It is very useful. Otherwise, what can be done is you can take this turmeric with ghee. Okay, so either with milk or with ghee, it is definitely going to be very useful to improve our immunity. And this haridra, no, it is mentioned as immunomodulator, and it is very useful in several allergic conditions. You can observe this slide also. Here, also the mentioning of haridra is also there. Okay, so haridra, that is turmeric, when we mix with certain different combinations, it is definitely going to be useful to all of us. Like for example, when it comes to skin allergy, it should be mixed with milk, or it should be taken with ghee. When it comes to tamakashvasa or respiratory symptoms, we need to mix this turmeric with honey. Okay, so that is being displayed in this slide. So one simple combination here is turmeric with honey. Then another very important combination which we can use is haritaki, that is Terminalia chebula, which is known as Chebulic myrobalan, so which can be mixed with water. This is also going to be very useful. Again, haritaki, all of you, we know that it is one of the rasayana dravyas. So I think we can understand the role of rasayana in controlling the allergy and also improving our immunity. This plays the major role. Then one more combination which is said here is the combination of Terminalia chebula, that is haritaki. It should be mixed with honey. So here quantity is very important for us. Like usual quantity is 5 to 10 grams. With honey, it has to be consumed. See, it should not be more than 10 grams also, because haritaki is also the medicine also should be digested properly. Otherwise, it is going to be again causing some harmful effects. There are chances. So it should be in limited or required quantity only. Then one more medicine which can be practiced in our houses only, that is haritaki mixed with shunti. Shunti is nothing but ginger. Okay, gingiber officinale, that is the botanical name of it. Churna form, it has to be used with water. One more very common remedy which can be practiced is in that slide you can see vasa, that is Adatoda vasica, which is known as Malabar nut in English. Again, very useful when it comes to difficulty in breathing. So, where we need to prepare decoction of leaf of this vasa, it should be mixed with madhu. Madhu means honey. Uh, Madhu should not be mixed when it is hot. So when the decoction which is prepared, one is becoming a little cool, then only you need to add honey and then you can consume it. Then one more remedy would be sariva, that is sarsaparilla, it is known as in English. Hemidesmus indicus, a decoction of it has to be taken with ghee. Then one more is ardraka, that is fresh ginger juice should be taken with honey. All these things are no very simple remedies with which we can easily manage only mild to moderate allergies. It's not severe allergies. We cannot manage. Okay, one more question. Do you think that lack of sunshine in UK makes our immune system weak, or is it just food habits? Uh, Partly you are right. Sunshine also very important. We need to expose our body to sunlight. That is also there. But very important thing is the seasonal variation also may cause some allergies, and even food habits, as you rightly mentioned here. Food habits needs to be adjusted as per our requirement. That's why in Ayurveda, food habits are very clearly mentioned, which is pathya, which is apatya, which is conducive to our body. Like particular season, we need to take particular preparation, which is prepared from particular pulses or dhanyas, what we say. And again, one more thing is genetic factor is also very important thing. We need to like should not show much sudden reaction to the allergens. So if you're not showing any much reaction to allergens, so then we'll not have any severe type of allergic manifestation. So that would be the answer. Then coming on to the one more common allergies. So mainly when we are exposed to dust particles and all, we commonly come across with rhinitis. We call it as pratishyaya in Ayurveda. To maintain this condition, also we do have certain remedies, common remedies, which can be practiced in our houses only. But every allergies, very important factor we need to keep in our mind is we need to avoid causative factor of any allergy. That is the first thing. Then next one is when it comes to pratishyaya or rhinitis, intake of trikatu churna. So trikatu is a combination of three drugs, important drugs: pippali, maricha, and shunti. So pippali is Piper longum, maricha is Piper nigrum, shunti is, you all know, that is ginger, that is Gingiber officinale. So common combining all these three, it should be 3 grams with honey. 3 grams of this Trikatu churna can be taken with honey. Then Parnayavani, its picture is displayed in the slide. Juice of this Coleus umbilicus, that is 5 ml, has to be taken with honey. It's going to be very, very useful in case of rhinitis. And a very famous preparation which is there in Ayurveda is Sitopaladi Churna. That should be taken 2 grams with honey. It's again going to be very, very useful. Then one more allergic condition is netrakandu. So that is itching in the eyes. I don't say conjunctivitis here. Conjunctivitis is a very severe condition actually. It should not be managed with simple medicines. It needs higher treatment modalities. So here I am just mentioning itching in the eyes. So that is also a result of any exposure to allergy. So in this condition, very good remedy would be guduchi, that is Tinospora cordifolia. It should be mixed with Triphala. All of you are very familiar with the word Triphala now. That is Amalaki, Haritaki, and Vibhyataki. It should be mixed with Pippali, that is Piper longum. You need to prepare a decoction out of it, and 20 ml of this decoction should be taken twice a day. Then one more combination would be, as the picture is shown here. This is the plant. We call it as Bhumya Malaki. That is Philanthus amarus, a very useful plant in improving the conditions when it comes to Netrakandu. Uh, that is to be mixed with Saindhava Lavana, rock salt, and any source substance can be added to this. We need to prepare the paste out of it, and it should be kept on the eyelids. So, which is going to be very useful when it comes to Netrakandu or itching in the eyes. Otherwise, Shobhanjana, that is horseradish, Moringa oleifera, the paste which is prepared from the leaf of it, it should be prepared in the form of bolus, and it should be kept on the eyes for some time. It is also going to be very, very useful in itching in the eyes. Then one more common manifestation when it comes to allergies is Twakvikara, that is various skin infections are there. It can be managed with certain Ayurveda remedies, which can be prepared in our houses only. One simple thing is we need to triturate the leaves of Aragvadha, which is botanically known as Cassia fistula. It should be mixed with Kakamachi, that is nightshade, Solanum nigrum. Both the pictures are there here. The leaves of both these plants, it should be triturated with buttermilk, and it should be applied externally. Okay, so then guduchi decoction, Tinospora cordifolia, it's called as giloy actually in English. So it should be subjected for a particular type of decoction. So here decoction preparation is very simple. The stem part of this guduchi has to be taken. You need to crush it, add 4 parts of water to it, then reduce it to 1/4 quantity. So this has to be consumed every day in the early morning on empty stomach. Again, this is going to be very, very useful in case of skin infections. Either you can also prepare guduchi plus nimba. That nimba is very famous for skin infections. So it is botanically identified as Azadirachta indica. Very commonly we call it as neem plant. Although also this decoction is also very useful. And one more very common drug when it comes to allergies, haridra, that is turmeric, should be taken with water. It's also very useful in case of skin infections. Then when it comes to food allergy, here we need to be a little bit careful. So food allergies mild or moderate to some extent, then you can go for this treatment, that is piece of ardraka, that is fresh ginger. It should be mixed with pinch of salt, should be consumed before taking any food. So this is one simple remedy which we can practice, but understand it should be done only in mild conditions only. So if it is moderate to severe, I think we need to take care with some special care. Otherwise, we may end up with some complications. So in these allergic conditions, we repeated the word rasayana quite a number of times. Rasayana, the word meaning is rejuvenative. How can I improve my immunity? uh, with some of the remedy. So these are the some important rasayana dravyas which will help us to improve our immunity. The first one is ashwagandha. So ashwagandha is very famous one which is botanically identified as Vidania somnifera, which should be taken with milk or it can be taken also with ghee. A minimum for 15 days if you take means you will get a little bit good immunity. This is one very important measure you can adopt. Then one more important drug as the picture shown here is guduchi, that is Tinospora cordifolia. The powder of it has to be taken either with ghee or honey. Again, it is going to be very useful as rasayana. Then one more very common rasayana dravya we always use is amalaki. That is Indian gooseberry, botanically identified as Emlica officinalis. The powder of it has to be taken with honey. Otherwise, one more method is the kwatha, that is decoction of this amalaki, Indian gooseberry. It can be taken 40 ml in a day. Also going to be very useful as rasayana. When it comes to single drug, so there are quite a number of drugs, but I am going to mention 4 or 5 drugs here which can be used on regular basis, which can be used without any complications. So one of the best in allergic conditions, as we have come to know that this haridra or turmeric is repeated quite a number of times in different kinds of allergy. So I have said golden milk in one of the contexts. Golden milk is nothing but a combination of haridra and milk, turmeric and milk. That is called as golden milk. So this golden milk has to be taken on empty stomach in early morning every day. It is going to be very useful, which boosts our immunity. Then another thing is when it comes to specifically respiratory conditions like difficulty in breathing or cough, such conditions, this turmeric has to be taken with honey. Then one more thing method of using haridra would be the decoction or you know a quarter, what we say, it can be used internally. So the dose would be 20 ml per time. So twice or thrice also you can consume it. So which improves our immunity. Or the application of haridra is also advised in skin conditions. Then one more drug which is again commonly repeated. It's a sort of summing up the things. Amalaki, that is Indian gooseberry, botanically identified as Emlica officinalis. So this is one of the best rasayana dravya, what we say rejuvenator, which improves our immunity. Daily you can consume this amalaki churna. One common proverb we always say is eat an apple a day, keep the doctor away. So from Ayurveda, we suggest to adopt this amalaki as daily medicine. That is, eat an amalaki a day, keep the doctor away. So here amalaki churna, the powder with honey is very useful. Then even amalaki leaf also can be taken, like it should be triturated with milk and which is applied over eyelid. So in itchy eyes or redness, any secretion is there, if pain is there, any congestion is there in the eye, can also be uh, in those conditions also it can be used. One is Vidania somnifera after COVID. So this drug is spoken much about because of its immune boosting property. So this is one of the best balya. So balya means bala, which increase our strength. And how to take this ashwagandha? This powder of the ashwagandha should be taken with either milk or with ghee, or it can be taken with simple water also. The alkali which is prepared out of this ashwagandha also advised with honey and ghee in case of improving our immunity. So this khadira is one more single drug which can be used in all skin conditions. So the decoction which is prepared, so out of this heartwood of the plant khadira, which is botanically known as Acacia catechu, is again going to be very useful. The dose would be 20 ml twice a day, again which is going to be very useful in skin conditions, any allergic skin conditions, itching, all those conditions it can be used. Another two drugs which can be used commonly is one is Saptaparna, which is botanically known as Alstonea scolaris. So here the decoction which is prepared from the bark of it, as the picture is shown in the slide, which can be taken uh, 20 ml dose twice a day. Um, yeah, one more question I got. How much turmeric? So turmeric in general, it is advised to take 3 grams in a day, a total day. The amount of turmeric which is advised is 3 grams, not more than that. Then coming on to the one more drug, Arjuna, that is Terminalia Arjuna. The decoction of this Arjuna bark can be very useful again in case of many skin conditions. Very useful, which again boosts our immunity also. 20 ml dose, that is advisable. Then coming on to the discussion part, Um, allergies caused because of the exposure to many allergens, which we have discussed in the previous slides. It may be, food allergens, or it may be exposure to dust or animal dander, such things. There are many allergic causative factors. So this is because of exposure to any allergens. So manifestation of all these allergic symptoms, so that depends on particular cause and triggering factors. Suppose dust is you are exposed to dust, then it is common symptom is rhinitis or any respiratory symptoms. If we expose to food allergens, then naturally we develop food allergy, maybe stomach pain, diarrhea, vomiting, such conditions. So again, dust if it falls in our eyes, we'll have itchy eyes or redness or congestion in the eyes, such things. So here the person's immune system plays a pivotal role in resisting allergic diseases. So allergens cannot be avoided because it is there in our atmosphere. So the answer to face such situation is improving our immunity. Okay, so that means we are not supposed to react quickly, so that we can avoid manifestation of many allergic symptoms. So knowing the causative factors for the allergy is very important in preventing manifestation or even aggravation of the allergic symptoms. So here there are 2 points. One is manifestation of any particular allergic condition. Definitely it is because of some allergens. So if we know what is the cause for this kind of symptoms, then we can avoid that. So we need to trace causative factors which are responsible for this allergic conditions. Suppose we are already exposed and there are manifestation of symptoms. So what has to be done? We need to reduce the exposure. Then only we can face the problem. So if you are taking some medicines, you are also exposing simultaneously, then you cannot reduce the symptoms. What are the treatment modalities in general which is available? So there are three major steps. They are avoiding the causative factors, improving immunity, then third would be treating the symptoms. So these are the three major steps which are to be adopted in treating the allergic conditions. When it comes to causative factors, it should be avoided first, like any pollen. If a person eats more of ice creams, then also they may have allergic conditions. And if the person eats, sometimes he may develop by eating oily or fried items, they may have certain allergic reactions. So causative, when it comes to causative factors, we need to reduce the exposure. That is very, very important thing. Then we need to take several precautions while consuming the food items. Suppose if a person eats any kind of substance, mm, he knows that it is going to cause some allergies to him, then he should try to avoid such eateries. So then he can overcome the problem. Then the second step is improving our immunity. So we need to resist the occurrence of any allergies. That is very, very important thing. So that is possible by improving our immunity. So if we have very good immunity, then it controls the manifestation of any allergic conditions, or it reduces the severity of the symptoms. Regular use of immune boosters or immunomodulators are advised. So regular use of these immune modulators, which are mentioned in the previous slides, like ashwagandha, that is Vidania somnifera, very important one in improving our immunity. Then Goduchi, that is botanically identified as Stenospora cordifolia, which is again very, very important drug to improve our immunity. Then Haridra curcuma longa, that is turmeric, which is very commonly mentioned in all kinds of allergy. Then Amalaki, botanically identified as Emblica officinalis, as we discussed the importance of this drug. Then the combination of Triphala, that is Amalaki, Haritaki, and Vivitaki, again very, very useful in case of improving our immunity. Then to improve the immunity, we can also go for purification procedures. In Ayurveda, we say it as panchakarma. What are those panchakarmas which can be adopted? So, if possible, so Virechana, that is purgation therapy, Vamana, which is known as emetic therapy, Basti, that is enema. There are two kinds. One is Niruha Basti, where we give decoction as enema. Then, if it is given with oil, then we call it as Anuvasana Basti. Then, fifth one is Nasya, that is installation. So, these are the five procedures uh, which help us to improve our body functions. In turn, it also improves our immunity. So Virechana is purgation therapy which keeps the Pitta dosha under check. So that means if any possibility of getting Pittaja allergy or Pittaja diseases, the person can undergo this Virechana therapy. Then which help us in maintaining optimum functions of all the organs of our body. Then if it is Vamana therapy, mainly it focuses on Kapha dosha, which keeps Kapha dosha under check, which helps in maintaining proper fat in our body. Then Basti, there are two kinds as we discussed. This is also known as enema therapy, which keeps Vata dosha under check. So three types of doshas which are mentioned in Ayurveda, they are Pitta, Kapha, and Vata. Virechana takes care of Pitta, Vamana takes care of Kapha, and Basti takes care of Vata. So all these can be adopted effectively in our routine, or once a year it can be performed to improve our immunity. Then Nasya, that is installation, which improves the functions of all of our sense organs. So like which also improves our immunity also, which throws out all the unwanted things from the nose. And one more thing which we need to adopt is treating the symptoms. Suppose If already the symptoms have very clearly it is manifested, then we can go for treating such particular symptoms. That means symptomatic treatment can also be adopted. So there are many medicines which can be used as per the condition. Okay, so assessing the doshas which are involved or manifested will help us in selecting particular drug or planning the treatment. So, for example, if a person is having any respiratory symptoms like sneezing or difficulty in breathing and all, so then use of medicines which are prepared from haridra, haritaki, amalaki, or pipali can be effectively used. Or use of these medicines, no, they are very beneficial. So, if there are symptoms like rashes or redness, so then the drugs which are having specifically pitta shamaka karma, pitta shamaka actions, they are very beneficial. So if there are food allergies, okay, then like, but it is a very tricky condition. We need to take some precautions in this. Uh, Needs proper planning. So immediate management is expected here because it may lead to severe conditions also. If a person develops severe diarrhea after food allergy, then we should not like keep quiet. We should always hospitalize, or we need to go for higher treatment also. That is also very important thing. If a person is having again a severe vomiting after consumption of food which has caused allergy, then again the same. Even hospitalization or taking higher or special care is very important. So if the person is having only indigestion after taking certain food in the form of any eateries, then we can go with certain digestants like which we discussed. Term This one ginger, it should be taken with a pinch of salt, which help us to overcome this food allergy. But here we need to be very careful that only mild condition when it comes to food allergy can be managed here. So coming to the conclusion, so allergy, which is a very common problem, which is faced by most of the people, almost all the people, one or the other time in their lifetime, definitely will face this allergic situation. Maybe very mild also. Definitely they would be facing this, and good immunity or immunomodulatory drugs, which are the answer to prevent or to reduce the severity of the condition. Then, when it comes to Ayurveda, we have, as we discussed, so many things from Ayurveda. Ayurveda has much to offer, maybe to improve our immunity or to know about our body conditions or to adopt certain common things which can be used in our daily routine. So, which are helping us to improve our immunity or to face the allergic problems. So, Ayurveda has much to offer. Then when whatever may be the allergic conditions, very important thing is first thing what we need to do is we need to avoid the exposure to any causative factors. So that is the first step to overcome this problem. So in intake of immune boosters which are beneficial, or any panchakarma procedure which we know we have discussed, which is going to be very useful. And treating only mild symptoms by common medicines are advised, and when it comes to severe symptoms, we need to hospitalize the person for higher treatment. So, with this, I would like to thank the organizers for giving me this opportunity. I would like to thank Archana and Vineet for helping me to present this topic. Of course, there were some technical glitches. Hope everybody understood the inner thing of this Ayurvedic management of allergies. I would like to thank my principal, Dr. Prasanna Narasimhara, for giving me this opportunity. And thanks to all the listeners of who have joined online through different media. Thank you so much. Namaste.